Let's spend a few minutes on the latest with the COVID-19 pandemic. Here to do that is Dr. Jim Nora, the Medical Director of Infection Prevention at Bryan Medical Center. Dr. Nora, thanks for being with us today.
Thanks for the opportunity.
Well, I want to ask you off the top here about the new strain of the coronavirus that we're hearing about. And there's been reports that it's even more infectious than the original strain. What can you tell us about it?
No, that's a great question, one we get a lot. And there are a variety of new strains that are being seen around the world. And they're certainly here in the U.S. as well. There's certainly some speculation that they could be more transmissible. However, we really haven't seen that. And that is reflected in the numbers of cases we see every week. And for the last several weeks, we have seen nationwide and in Nebraska a steady and continuous decline in cases. So to me, that speaks somewhat against the hypothesis that this strain is more transmissible. We don't know all the facts yet, but that is something that will continue to be monitored.
And do we think any of those new strains are actually in Nebraska at this time?
I think it's likely that there are some new strains here. There are new strains in Colorado, in Wyoming, Minnesota, Wisconsin, many states that are very close to Nebraska. So I suspect there are some strains here in Nebraska, but that has not yet been proven.
Let's talk about hospitalizations, because they dropped below 10% last week, and that allowed Governor Ricketts to move everything into the green, or the lowest directed health measure. And that means across the state, with Lincoln being the exception, indoor gatherings can be at 100% of capacity now. What are some of the concerns with that? Could we be doing this too soon?
That's always a concern, and it is certainly great news to see our cases dropping, but I would definitely caution folks to be on the lookout and to not necessarily jump right into large gatherings. There is a large segment of our population that is not immune right now, that have neither seen COVID nor have had the vaccine, and those people remain exquisitely vulnerable to infection.
Let's talk about vaccinations as well. 207,000 Nebraskans have been vaccinated, almost 4% of the eligible population at this point. So the whole state is expected to be in phase 1B this week, vaccinating elderly and the high risk, as well as some other high profile types of groups. How do you think overall the vaccination process is going for Nebraska?
I think it's going well. There have been occasional hiccups in terms of getting things out, but I think that the biggest limiting factor is the supply of vaccine. I think we have the capacity to vaccinate even more individuals if we had more vaccine, and that's the way we want it to be. We want to have enough resources to vaccinate everyone who wants to get a vaccine. What we're waiting on now is ample supply.
Do you see any promises that that's going to improve in the future, that supply?
Absolutely. We're hoping that we'll have a couple of additional vaccines available soon. In fighting this pandemic worldwide, it's going to be really important to have a variety of vaccines. And one that's particularly exciting, I think, is the upcoming vaccine from Johnson & Johnson, which is just a single injection. That's not as effective as the two-stage vaccines, but it is much more easy to deliver to some difficult-to-reach populations.
That's good to hear. Dr. Jim Nora from Bryan Health, the Medical Director of Infectious Prevention. Thank you very much for being with us today.
Thank you.
And you can follow the NET News Team's coverage of the COVID-19 pandemic at netnebraska.org/coronavirus. Also, if you want to go to the Bryan Health site, they'll have any questions and answers for you there regarding the vaccination process. That's bryanhealth.org/vaccine.